So my name is Joshua Willson, and I am a psychometrist. Psychometry testing is a way of numerically gauging different levels of function in the brain by measuring behavior. So for example, we look at different domains like memory, attention, visual spatial skills, motor function, also emotional functioning. So we cover a wide range of abilities that people have. So to become certified, you have to have at least a bachelor's and 3,000 full-time hours of testing, scoring experience on the job. If you have a master's or a doctorate, the requirement is 2,000 hours of on-the-job experience, which equates to 2,000 hours is about a year, and the 3,000 would be a year and a half. So the way I got it was I got hired by a neuropsychologist in Virginia Beach, and before I got certified, he would train me, and I was sort of like a paid intern, you might say. So just gaining experience and familiarity with the tests, and then and documenting the time spent, and then we put that together with my application package for certification, and then I had to pass a 2-hour test to receive certification. So there's a wide variety of different people that come in for psychometric testing, and it really depends on the question that they were referred for. For example, a lot of people in a neuropsychological practice are referred for pre-dementia testing for Alzheimer's. If they suspect they might be having symptoms of that, they'll go through a battery of tests to rule in or rule out that possibility. Another population of testing patients are people with concussions, athletes, football players, hockey players, or people who have been in auto accidents and want to find out what the lasting effects of that might be. And one other group is students. They do a lot of academic performance testing to see where a student might be struggling and what accommodations can be made to help them achieve success. Any level of children through college, understanding how their brain works in terms of completing attention tasks. So if a person is shown to have a low reserve of attention resources, the licensed psychologist that is interpreting these results can make recommendations. Okay, so for here, we're part of the pain management department. And so Dr. Robinson or any of the doctors, if there is more information to be gained that can help direct a patient's course of treatment, they'll refer for testing. And I like to think of it as being sort of like we have X-ray technicians and an orthopedist will use information from the X-ray to decide on a course of treatment. And similarly, these tests that we do, the psychometric tests, are what our psychologist uses to help him determine a course of treatment. At Hampton Roads Neuropsychology, the clinic that I worked at before, we had a lot of those other types of patients, like a lot of pre-dementia cases, a number of athletes. I got to test a couple of pro football players and some of the players on the local hockey team, and students who had been injured in sports. We also tested a number of legal cases, so where there's litigation involved, so again, auto accidents or workers' comp cases. So you never know what the day will bring. It's kind of a funny story. So I majored in cognitive studies and minored in psychology in California, and I worked at an adult behavioral day program. But when we moved to Virginia Beach, I was job hunting, and one of my relatives who lives in the area handed me a newspaper clipping that was advertising for psychometry. I had never done it before, but they said, "You're into psycho whatever, how about trying for this job?" And so I applied and eventually got the position and just started learning how to administer the tests and fell in love with it. I would just add that I just really enjoy what I get to do here and the people that I get to meet, and to know that I'm helping in some small way.